Good morning, Mr. Chairman. Currently, we have one in the waiting room, and that's it.
Great, that's my kind of morning. I think we'll go ahead and get started here. It looks like we're live on YouTube, is that correct?
Yes, Mr. Chairman, you're live.
Very good, thanks, Amanda. Okay, Mike, let's go ahead and start and go ahead and take roll.
Senator Bouchard.
Senator Bouchard.
You should say here.
Senator Furphy.
Here.
Senator Hutchings.
Here.
Senator McCune.
Here.
Chairman Baldwin.
Here.
Thank you.
All present. It's Monday morning and the whole party is here. Welcome to Labor, Health, and Social Services. I'll get that right. We have one bill in front of us today and one representative in front of us today. The bill is 109, Local Health Officers, Education and Requirements. Welcome to Labor and Health Representative, and welcome everybody in virtual land. Come on up, Hans, and tell us about your bill.
All righty, thank you, Mr. Chairman and committee. Mr. Chairman, I present to you House Bill 109. Mr. Chairman, this is a bill that was an issue that was brought to my attention that as an issue that has come out of a recent / sort of ongoing pandemic, but this I'd like to emphasize isn't just specifically related to the pandemic. Currently, Mr. Chairman, when it comes to local health officers, whether they be appointed by the city, the county, or a regional district, only MDs can qualify to be appointed to that position. And so it came to mind to expand the definition of that qualification to include RNs and physician's assistants. And so, Mr. Chairman, what this is mainly about is with our smaller counties and our smaller communities, there's already a shortage of doctors, as I'm sure you probably well know. And so while there are no residency requirements for the position, it's hard to sometimes find people to fill these positions. And so I represent Weston and Niobrara counties, and not too recently, but some years back, Niobrara County went for several years without a health officer, just because there was nobody around. And currently, their current health officer, Dr. Jolene Falkenberg, who has done, I would say, an exceptional job during this crisis, actually lives across the border in Nebraska. She's would consider that to be her home community. But the point is, Mr. Chairman, it's difficult to find these folks. And in the wake of public reaction to the action taken by local health officers at the direction of the state, as you know, many of them have been, well, it depends on what the circumstances are. At least a couple of them have been fired. Some have not had their contracts renewed. At least one of them just quit and resigned. And with the public backlash to those policy actions, it's not going to be easy for folks to find folks who are willing to step up to the plate to just take this job. And so, Mr. Chairman, that is in essence the bill. Is we're simply expanding who can qualify as a health officer, and the positions that are being added here, having consulted with you, Mr. Chairman, and with some other folks who are familiar with the industry, these people, MDs and RN, or excuse me, PAs and RNs, are, as I would understand it, every bit as qualified to handle the duties of the public health officer as would be a medical doctor. So, Mr. Chairman, that is the bill, and I can either walk you through it or take any questions at this time.
Why don't you go ahead and walk us through it real quick, because it's pretty short.
Good. Mr. Chairman, we are starting on page 1, section 1. We are amending current statute 35-1, 305, subsection A over on page 2 to say, starting on line 5, any full-time and this is the new language, any full-time or.
I would tell you that you're probably working off the original draft, and we have in front of us the engrossed copy.
That's
so
correct,
different.
But I do have the amendments over here.
Okay, yeah, the line numbers differ from what you're saying.
Oh, I'm sorry. Oh, I apologize. But okay, let me see if I can.
I'm
Find
sorry.
the engrossed copy. My apologies, Mr. Chairman. Goodness.
Go ahead with the question, Senator Bashar, if you got a question.
I just have a question. Can we get him a copy of the?
There we go.
Thank you.
Perfect.
Thank you, Senator. My apologies, Mr. Chairman.
No, that-
Okay,
you're
so,
fine.
let's start over. All right, on page 5, line 2, this is the engrossed copy. The new language begins saying, any full-time or part-time health officer shall have a degree of Doctor of Medicine, be an advanced practice registered nurse as defined in statute, or be a physician's assistant as defined in statute. Full-time or part-time health officer appointed under this section shall assist the State Department of Health in carrying out the provisions of all health and sanitary laws and regulations of the state, and shall complete continuing education in public health as directed by the local Board of Health. And then, Mr. Chairman, over on page 3, we're just sort of divvying that down to specifying the differences between the county, municipal, or district health officers. So, excuse me, page 3, line 16, the new language says, striking out he and saying the county, municipal, or district health officer. And then jumping down to line 18, be an advanced practice or registered nurse as defined by statute or a physician's assistant. And then the county, municipal, or district health officer shall assist the state, et cetera, et cetera. And then over on the last page, page 4, top of that page, shall complete continuing education in public health as directed by the local Board of Commissioners, the health district, or municipal governing body. And Mr. Chairman, that language was something of a compromise brought on the floor. I'm rather ambiguous as to it. I mean, take it out, leave it in, Mr. Chairman. I don't really care. I don't think it puts too much restriction on the original intent of the bill, because there's nothing specifying a timeline as to what that continuing education needs to be or anything like that. But again, that's at your discretion, Mr. Chairman. So that is the bill. And yes, I'd be happy to stand for questions.
Very good. Question, Senator McEwen.
Did we avoid putting the state health officer in this bill? As I look through it, it seems to be directed at county down. So does that mean we still have to have a doctor at the state level? Thank you, Mr.
Representative, go
Chairman.
ahead.
Mr. Chairman and Senator McEwen, that is correct. And I think that would be, Mr. Chairman, if that's correct. And I think that would probably require a separate bill as the requirements for the state health officer are another statute. I can't remember off the top of my head where that sits. But
That is in a separate statute.
Yeah,
You're correct,
I would.
Representative. Follow-up question?
And I believe on your continuing education, if you go back to the statutes that are coming into this bill, that's already defined for them to maintain their title as what it is already anyway. Is it not, Mr. Chairman?
You can answer that if you want, or I'll throw it in. I said the continuing medical education is defined by the board, whichever board they're under. But specifically, this is continuing medical education. And Representative can correct me, but I believe it relates to things like bacteriology, that sort of thing, specific to public health, which is not necessarily specifically required in their board, to be at the Board of Medicine or the Board of Nursing. So I think this would be a more specific thing and related to public health emergencies. That's my interpretation. Is that correct?
Mr. Chairman, that's correct. Yes. The idea was that they would be directing their education towards general, whether it's a master's of public health, general epidemiology, et cetera. Not necessarily directly related to the current requirements.
And I suspect this is similar to the coroner type job, where, anybody can be made a coroner, but there's specific continuing education that they have to meet the requirements. And I would assume that this would be specifically the same.
Mr. Chairman, yeah, I'd say that's correct.
Very good. Senator Bashar.
Mr. Chairman, I think you had the discussion about the continuing education, so I think I'm good. So you've answered all my questions.
That was the easiest question we're going to have all day right there. Senator Hutchings.
Thank you, Mr. Chairman. Representative Hunt, thank you for explaining the bill so nicely. Before the pandemic, I had no idea about healthcare officers and so on and so forth. But this person is specifically going to be at the county level assisting the state officer. So during the pandemic, the health officer doesn't necessarily, of the state, doesn't necessarily go to each county. They send their representative to do the investigations and maybe issue quarantine. So it's this person, not so much the state officer that's doing this job.
Representative.
Mr. Chairman and Senator Hutchins, that's correct. And that's the idea and I should point that out. Thank you for bringing that up. Even though this individual is appointed at a local level, they answer to the state health officer and that office. And, but it's, where was I going with that? Yeah, they answer to the state level. And if there is not a county health officer or somebody at the local level, whether it's the city, county, district, then that entity, that county is under the purview directly by the state. And that again, Mr. Chairman, that's been true in the past where, again, using Niobrara County as an example, in that time period when they did not have a public health officer, a county health officer rather, they were under direct supervision by the state, so.
And I would add to that one thing, is that it goes the other way as well. When something comes up on the county level or the local level, if they have a question, be it a doctor, be it a PA, or be it whoever, they then seek out the advice of the state public health officer. It's actually, it probably happens more that direction than the other direction. As likewise, the state health officer will sometimes seek out the CDC or seek out a national source, but it sort of feeds both ways. Senator Furphy, go ahead, sir.
Thank you, Mr. Chairman. Yeah, my question is along the same lines. When I originally read this bill on page 2, line 11, I was wondering why it said shall assist State Department of Health, but didn't outline any direction from county commissioners, city councils, et cetera. So it just says, shall assist State Department of Health in carrying out the provisions of the health and sanitary laws of the state, and did not give the locals control over this officer if there were specific county, municipality issues to deal with. But sounds like that was your intent, Representative Hunt, to not include that in here. Is that correct?
Go ahead, sir.
Mr. Chairman and Senator Furphy, yes, to an extent. I think that and Mr. Chairman, correct me if I'm wrong, because I may be, but the idea of having a county health officer or someone at the local level is that obviously they're a member of the community and they understand the local circumstances, and whether that's a global pandemic or whether that's some restaurant salad bar that may come up with E. coli. And so, I mean, before this all started a year ago, that was, I think, the main intent. They've always had these powers on a broader level that we've seen used, but at the local level, it's more to the point of sanitary conditions and so forth. So if your restaurant isn't up to specs, and I understand that that's also handled by state level people too, but if you have a local salmonella, E. coli outbreak, something to that effect, then that local health officer at their discretion, without having to have the state come up from Cheyenne, can come in and shut down your salad bar or your restaurant or whatever the case may be until that issue is corrected. But Mr. Chairman and Senator, no, they still answer to the state health officer, and I'd have to learn more about the ins and outs and what have you of that before addressing that further. So I hope that answers your question.
I would say it's akin to the fire department, and pardon me, but that's the thing I always relate back to is that you have local fire departments, you have a state fire marshal. State fire marshal, it's not practical for them to report to your garage fire. In that case, you have the local people, and I think it's similar in the public health. For an immediate response for the E. coli outbreak at the local restaurant, the public health officer there in your county can respond immediately, and then a follow-up response from the state to tracing, et cetera, can happen. That's the example that I would give. Further questions, committee? Nope, then we'll let Hans off the hot seat for a few moments and go to the audience. You did gain an audience while you were turning around there, Hans. I see the county commissioners are here. Come on up to the seat, sir. Sir,
Thank you, Mr. Chairman.
only one's coming up? Oh, okay. Have a seat. They're all good seats. Go ahead and introduce yourself and present yourself, Commissioner.
Thank you, Mr. Chairman. Jim Willix, President of the Wyoming County Commissioners Association, here on behalf of the commissioners. And we do support this bill in its form. We think it's a good bill. And some of the questions you've asked kind of lead to how this is important. Is many of our small counties really don't have many MDs to choose from, or they're so busy with their individual practices that expanding the pool of people eligible into the two categories that include is really valuable and really broadens it up. I have a county with a lot of MDs, and we struggled to find somebody that wanted to do it pre-pandemic, just because, it is a little bit of a time commitment. It is not, you have to have an interest in public health rather than, dealing with patients on a regular basis. So we really believe that basis of the bill is very valuable and helpful to a lot of communities, and will still keep the quality of public health officer that we need. The education requirement we support because that helps us guide some things that may be important in our background. Maybe getting some feedback. I'm loud to begin with. Sorry, Mr. Chairman.
I apologize for the noise above us.
Yeah.
I think they must be moving snow or something.
Oh, I thought maybe it was me making it echo. So
Well,
no,
it's
it's
street
the
level
bowling
above
alley
us.
right above.
Right? Is that correct? The street level above us, so they're probably moving snow.
Oh, okay.
Okay, go ahead, Commissioner. Just
Thank you, Mr.
talk
Chairman.
louder to get over the noise.
But that education requirement, also, one of the things we've learned in this, and maybe a communications class might be a valuable local education class for a public health officer to take. But I want to go back to really, let's think about what the public health officer is prior to a year ago. That public health officer was dealing with failed septic systems and having to have people evacuate a house because they didn't have a sanitary condition to live in. There was a daycare center that has an outbreak and they have to deal with what has to happen in there. Boil water orders if you have a municipal or a small district water failure. So those are the day-to-day activities that these public health officers do in coordination with their local board of health. They work with our public health nurses on a daily basis or regular basis. So you've got that public health nurse, and it's in every county that is dealing with strep and dealing with those kind of things. Well, the public health officer also is dealing with them. So although the pandemic brought some of this to light, day one as a commissioner, I met as a board of health, and we were dealing with issues 14 years ago, and we continue to deal with those. So it is important to know that this is broader than the pandemic and is really an improvement on the entire system of the public health to broaden it. And again, Mr. Chairman, the commissioners support this as it's structured. We believe the amendments that Representative Hunt talked about on the education we support, and we support the various premise of this to broaden the pool of people that can be public health officers, and I would be glad to answer any questions.
Thank you, Commissioner. Questions for Commissioner Alex Willix? I said your name wrong. No questions, committee? Thank you very much.
Thank you,
for your
Mr. Chairman.
testimony. Is there anyone else in the room that wishes to testify today? Those on the back row have to get a head start up here, but not wishing to testify today? Nope. Okay, let's bring that one person in online if they wish to testify, Amanda.
Mr. Chairman, they don't have their hand raised. Oh, yes, they do. So I'm bringing them in now.
Okay. Good morning. I recognize that person. Welcome, doctor. Welcome to Labor and Health this morning. Go ahead and introduce yourself and testify.
Thank you, Mr. Chairman. Mr. Chairman, members of the committee, I'm Allie Harris. I'm the State Health Officer at the Wyoming Department of Health. We don't have any testimony. We just wanted to be here to provide answers to any questions that the committee may have.
Good. Are there questions for Dr. Harris, committee? No questions. You're off the hook easy this morning. Thank you for coming to testimony.
Thank you, Mr.
Are
Chairman.
there any further testimony in the audience? No further testimony or questions? Hans, would you like to come up to the table and work with us through here? I have one question. I noticed in reading the amendments that somebody discussed residency requirements. What was the discussion about that in committee?
Mr. Chairman, thank you. Yeah, that was an amendment that was brought on second reading that would have required the county health officer to be a resident of the state. That issue, Mr. Chairman, came out of the fact that Carbon County throughout this, their health officer has been residing in Colorado and sort of signing off on the orders from afar. But Mr. Chairman, as I said earlier, that's true elsewhere too. That's true in Cook County. That's true in Niobrara County. Having worked extensively with the county health officer in Niobrara County, to disqualify her from serving in that capacity, it would be a real disservice to the community. And so, Mr. Chairman, I think that while we can all agree that it would be preferred that that person be a member of the community and understand the local issues on the ground, we shot that amendment down because we didn't want to restrict it just for circumstances like that. If you and there's a number of our counties and on our border that are quite small, low population, and so that's why that didn't come forward.
Very good. Committee, would someone like to move the bill? Senator Hutchins moved the bill. Discussion about the bill. Committee amendments, changes, thoughts? Question is being called. Let's go ahead and call the roll, Mike.
This is for House Bill 109. Senator Bouchard. Senator Furphy. Senator Hutchins. Senator McCune.
Aye.
Chairman Baldwin.
Aye.
5 ayes.
Thank you very much. You did well, Hans. Thank you for coming to our committee.
Thank you, Mr. Chairman. Thank you, committee.
Come back anytime.
Yes, sir.
Okay, committee, that's the only bill we have before us right now. I expect another one or two to come up today. So you can anticipate probably on Wednesday, we'll have another bill. I just don't know what it is yet. But I know there's some on third reading over in the House today that may come to us. So thank you. And we will see you all again. And just to note, committee, we're already working on some tentative interim dates. I'll get those to you as soon as we've got them cleared. But we're tentatively looking at three on-site meetings, one in Casper, one in Riverton, one in Cheyenne, and likely 2 days of Zoom meetings just for educational stuff. So that's the plan at the moment, but I'll get back